Hi, this is David Dillard with Sleep and Sinus Centers, and I'd like to talk to you a little bit about sleep apnea today, and talk a little bit about some of the things that sleep apnea affects. And one of those is diabetes. Um, Diabetes is a scenario. There are a couple of different types, um, but diabetes is a scenario where you don't have sufficient insulin to manage your blood sugars, among other things. Now, insulin is an interesting compound. Insulin does all kinds of things, and its main job in life is to make you store things, um, so that when you eat, the blood glucose doesn't just go in to the sugar, to the blood and go right back out the kidneys, um, and that you can use that, and so you're not constantly having to eat to survive. Um, Having said that, the management of that process is intertwined with a lot of other things, and insulin has some undesirable effects when it's in large quantities. There are some um, elements to hyperinsulinemia, which causes blood vessels to gradually close off, atherosclerosis. They'll gradually get smaller, which of course is the root cause of heart attacks and strokes and peripheral vascular disease. So when you see kinds of um, those kinds of problems, um, one of the triggers for looking for sleep apnea should be seeing problems with diabetes. People with diabetes should all be checked for sleep apnea, especially if you snore. But you don't necessarily have to snore loudly enough to rock the house. Especially women. Women tend to have situations where they don't snore as loudly, but their tongue falls in the airway and they just stop breathing, and that's a problem. So, one of the things you'll find is that the diabetes control, not completely by itself, but diabetes control tends to get better when you're treated for sleep apnea. Oxygen, I guess, is one of the most important things on the planet, obviously, and we need it to survive. And the stress from the lack of oxygen tends to complicate our control of our sugars. Insulin will follow the sugar in the blood, and get more of it will get released, and its growth factor like aspects will cause it to cause the interior of the blood vessels to clot off, among other problems. But when you're stressed by not breathing, if you're snoring and smothering, it will cause a stress response, and the stress hormones like the growth hormone, the epinephrine, and the cortisol that comes from the brain being stressed out from lack of oxygen at night, will cause you to have poorer control of your diabetes. And that is something that you need to take up with your doctor and discuss. So, hopefully this is helpful. Just remember that even if you don't want to have to deal with CPAP, that there are other options available to you that are not necessarily horrendous procedures, easier to deal with than has been the case in the past. Things like radiofrequency ablation of the tongue base, and the VOTE, and the Inspire, and a few other types of procedures that can be very helpful for people. And these things are things to explore with your doctor.